Everybody, I am Dr. Prasanth, working as internist in Dubai. Today, I am going to discuss with you about a chronic condition called diabetes mellitus and its complication. Diabetes mellitus is a condition in which glucose cannot be utilized in the body properly. Glucose is the main source of energy of the cells in the body. The level of glucose in the body is maintained by an hormone called insulin. Insulin is produced by the beta cells of the pancreas. When there is insufficient production of insulin, or when the insulin produced in the body cannot be utilized properly by the peripheral tissues, the condition called diabetes mellitus occurs. Because of the insulin deficiency, the glucose cannot be metabolized in the body properly, and it builds up in the blood and will cause many of the complications which result due to hyperglycemia. There are basically two types of diabetes mellitus. One is type 1 diabetes mellitus and the other is type 2 diabetes mellitus. Type 1 diabetes mellitus is also known as insulin dependent diabetes mellitus or juvenile diabetes. Here what happens is that the beta cells of the pancreas is totally destroyed by the autoimmune antibody produced against the beta cells, and there is no production of insulin at all in these type of patients. This occurs more commonly with young children and young adults, and then there is total deficiency of insulin, they should be treated with insulin replacement apart from the diet control and lifestyle modification. And the second type of diabetes is type 2 diabetes. Type 2 diabetes is also known as non-insulin dependent diabetes mellitus. It is the most common form of diabetes mellitus. About 90% of the total diabetic population is suffering from type 2 diabetes. As per the International Diabetic Forum, there are 370 million total diabetic patients in the world, and it is estimated that it will rise to the level of 550 million by the year 2030. And who are the people who are affected by type 2 diabetes? Adults who are the age of more than 50 years are mostly affected. Nowadays it is common with teenagers and young children. And then what are the risk factors? People who are obese or overweight, and also those people who lead a sedentary life, the chance of developing diabetes is high, type 2 diabetes especially. And then what are the other risk factors? For type 2 diabetes mellitus runs in families, and so the relatives, first degree relatives of the patients with type 2 diabetes, they are more prone to get diabetes, type 2. And people who have got a waist circumference of more than 80 centimeters in case of women and more than 94 centimeters in case of men, they are also prone to get type 2 diabetes. Another group of people who can get type 2 diabetes is those who have an impaired glucose tolerance test. Now, what is impaired glucose tolerance? Impaired glucose tolerance is the condition where the blood sugar level is higher than normal but not higher than the level at which they can be labeled as type 2 diabetes. And then what are the clinical features or what are the symptoms of type 2 diabetes? Mostly type 2 diabetes is asymptomatic, and they may present with vague symptoms also. And as they are asymptomatic for a long time, they are detected either on examination for some other disease or when some test is done for some other disease for which the patient visits the doctor. And type 2 diabetes is also diagnosed while some of the screening tests are also done. And what are the symptoms with which they can be presented? The most common symptom is loss of weight for a prolonged time, and then other symptoms are increased frequency of urination, increased frequency of food intake, polyphagia, increased water intake, polydipsia, and delayed wound healing, blurring of vision, genital ulceration, genital itching. These are the other symptoms with which they can present. And then, how do you confirm the diagnosis of type 2 diabetes? A simple dipstick in the urine can detect the sugar levels. But this is not enough for a definite diagnosis. Blood sugar test should be done. And in some cases, we have to do the blood sugar checkup at 2 times. One is fasting blood sugar level and the other is postprandial blood sugar levels. That is 2 hours after food intake. Another method for diagnosis of type 2 diabetes is by estimation of glycosylated hemoglobin, HbA1c. HbA1c is the glucose which is attached to the RBCs in the blood. If the level of HbA1c is more than 6.5%, we can tell the patient has got diabetes mellitus. HbA1c decides the blood sugar level in the past 3 months of the patient. And then what are the other complications which can result due to type 2 diabetes? In other words, how does diabetes mellitus harm your body? Over the long term, high sugar level in the blood can cause damage to the body and cause failure of various organs. Common problems include damage to blood vessels, kidney, nerves, eyes, heart and brain. And what are the macrovascular diseases which can occur due to type 2 diabetes? As I told you, the complications which can occur due to diabetes mellitus can be divided into 2, that is microvascular complications and macrovascular complications. What is macrovascular complications? Macrovascular complications is the complications which can result due to effect in the large blood vessels. Due to deposit of calcium and deposit of cholesterol in the large blood vessels, they can result in blockage of the circulation to the various organs. And this is known as atherosclerosis. The place where the lipids and calcium is deposited is known as a plaque. And the area where the plaque is deposited, the blood vessels are weak and they can rupture and they result in a clot, and that is how they block the circulation. When they block the circulation to the various organs, as a result of which various damage to the organs can happen, and this can result in symptoms like angina in the heart attack, and then brain it can cause stroke, and in the peripheral circulation it can cause blockage of the peripheral circulation and can result in ulcers and gangrene, and it can also cause disease like erectile dysfunction and all this. I will speak about how the diabetes is being managed. There are mainly 3 aims in the management of diabetes mellitus, and they are: number 1, to control blood sugar levels; number 2, to treat the associated risk factors. If you treat the associated risk factors, complications can be delayed or prevented; and the third is early detection of the complications and the proper treatment. And how do you achieve the normal blood sugar levels? To achieve a HbA1c level of 6.5 is supposed to be at good control of the sugar levels. And how do you achieve this? This is by, number 1, by proper diet control and lifestyle modification. Patients should be advised to have a healthy diet with low carbohydrate, with low fat, high fiber content, with plenty of fruits and vegetables. And then the patient should be encouraged to have regular exercise. At least 30 minutes of brisk walking 5 days per week is to be taken compulsorily. Other exercise like jogging, cycling, dancing and all will be helpful in this type of patients. And people who are overweight or obese should be encouraged to lose their weight. And once the lifestyle modification and diet control is advised, and if the sugar is not properly controlled, then we have to start the patients on medicines. They are either single medicine or combination of medicines are used. and if still there is not control could be achieved, then the patient should be given insulin injections. And what is the second line of treatment? This most of the time diabetes mellitus is associated with other conditions called hypertension and high cholesterol levels. So proper detection of these problems and adequate treatment is essential in the management of type 2 diabetes. And what is the third factor which we should consider? Of course, the third factor, our idea is to prevent the complications. For preventing the complications, patients should have a regular checkup and regular follow-up. They should be done regular blood sugar levels, HbA1c levels, regular checkup of hypertension, cholesterol levels, all these things should be done. And ongoing advice about lifestyle modification and dietary advice, all this should be continued. And a regular ophthalmologic checkup to prevent complications in the eye like retinal diseases, glaucoma, and which are leading on to further blindness should be prevented. And regular checkup of the heart, and the urine should be examined for proteins in the urine, either microproteinuria or macroproteinuria, to prevent the renal failure and associated things. And other associated blood tests also should be done to prevent and detect the complications early and further to prevent them. And then what is the take-home message? The advice I want to give patients with type 2 diabetes is that the proper control of blood sugar is the cornerstone of management of type 2 diabetes. If a proper blood sugar level is maintained, then we can prevent the complications. As per the international guidelines, as suggested by International Diabetic Forum and American Diabetes Association, we should maintain an HbA1c level of between 6.5 and 7% to control the complications. And some patients who are old age and those who have a those who have diabetes for a prolonged duration, we can bring it to the level below 8%. Because while treating, we should be very much careful about patient which lead on to the damage to various organs. And of course, as I mentioned, we should concentrate on treatment of other associated conditions like hypertension and high cholesterol levels, because most of the time patients with the type 2 diabetes are also having other disease like hypertension, high cholesterol level, heart disease. All these things will go together. So proper detection and treatment of hypertension, treatment of cholesterol, all these things are also important in managing type 2 diabetes. And if you detect the diabetes at an early stage, and if we do all the preventive measures to control the complications, then diabetic patients can also lead a normal and full life. And thank you very much for the patient listening. Thank you very much. Thank you.